Well, thank you for joining me. It's such a privilege to be able to finally do this interview. It's kind of ironic that when we were both in Lubango, living in the same house with our families, working in the same hospital, we weren't able to find time to do this. But now that you're on a short trip to the US and I'm back in Canada, we can um, finally have this interview. So thank you for joining me.
Yeah.
I'm sure you're very busy, so we're just going to get started. I have a few questions prepped, just so that we can learn a bit more about you and your journey and what you're currently doing at CML, and finally, what you foresee in CML's future. So maybe I'll briefly introduce you. So Dr. Sam Fabiano is a friend of ours. He is Angolan, born and raised primarily in Lubango, but we'll hear a bit more about that shortly. He is now a surgeon, a staff surgeon at CML, having recently graduated from the PACS program in Gabon, so the Pan-African Academy of Christian Surgeons. So without further ado, I'll start with my first question, so we can learn a bit more about you and your background. So as some people know, Angola had a civil war, which started in 1975, and there were continued interludes of fighting up until 2002, so just over 20 years ago. I hear that your childhood was a little bit eventful. Can you tell us a bit more about growing up during that time?
Yeah, so Angola, during the war, you were supposed to register at the age of 16, and then they would most probably call you at the age of 18 to serve in the army. But as time went on, I think the younger population of the country was shrinking, and so that age became a very gray number. To the point where they were taking kids that were 14, 15, 16 years old into the army. So I wasn't the exception. I've always been the tallest guy in class, unfortunately. And so for at least 2 times during our walk back from school, we were stopped by the army, and they put us aside and made us sit against the wall, and they took our stuff, and they were getting ready to take us to the airport and ship us off for military training, and then on to fight in the army. Thankfully, our classmates were nearby, and the girls stayed around, and the military guys weren't very smart, and they ran to go get other kids, and all of a sudden we had a break to somebody's yard, and they locked the gate, and we waited there until our parents came and got us and took us home. Another instance was we were in our house, and they were coming through the neighborhood, and so I really didn't have much time, so I ran into the house. I got into a 200-liter drum, and then my sister put a drum lid on top of it, and I stayed there until they came back and said, hey, they're all gone, and that was it. So it was very common. I think most people my age experienced that in some way or another. Some of us were fortunate to not end up in the army as kids. Some of us were not as fortunate, and that really changed the outlook of those people's lives. They are different people today, and they had so much potential back then. Yeah, it was a very interesting part of my growing up, I have to say.
Oh man, what a harrowing experience. And I'm sure those experiences stick with you even all of these decades later. Thank you for sharing that with us. So despite having gone through that as a child, you were how old again when that happened?
I was about 14.
Oh goodness,
Yeah.
14.
Yeah.
Okay. So despite that, like I had mentioned earlier, you have now become a surgeon. So for those that don't know, Sam and I, along with Matt and some other folks, met about 10 years ago at CML when I was on a visiting residency elective as an OB-GYN resident. And you were the very first intern, predating even the existence of the intern program at CML, which has only just started in the last couple of years. So as I mentioned, you recently graduated from the PACS program in Gabon and moved back to Angola to be the staff surgeon or a staff surgeon at CML. Can you tell us a bit more about your training journey?
Yeah. So it all started back in the day. I was when I was about 15, I had to go to Namibia because of the war again. And I spent about a year there, and I learned a lot of things about service, helping others, volunteering, and just putting others ahead of you, trying to do what you can to help others. And so that was an experience that stayed with me, and it's still with me today. I cherish those 10 months that I spent in Namibia. I then went on to finish high school. I went to college in Southern California at Concordia University. And upon graduation, I wanted to continue studying medicine. And so I ended up actually going back to Namibia, where for about a year, we helped start an organization that worked with AIDS orphans and AIDS patients. And that was very good. But every day I was reminded of the suffering of these people and the limits I had on myself. I could help them. I could take them to appointments and get their medications and just be that liaison for them. But at the end of the day, I wasn't really, there was a little bit more that I could do. It just felt like it. And so I talked to a friend of mine um, who was at the time studying in Russia, and he said, if you want to try something different, I'm in Russia right now, and it's different. It's very different, and I was like, it can't be that bad. I mean, I had experienced a little bit of the West. I've experienced a little bit of Europe, and so I was like, you know, let's give it a shot. So I applied and then ended up going to medical school in St. Petersburg, Russia. It was pretty rough getting there, and I was like, yeah, now I understand what he was saying. It wasn't very easy, but I found a wonderful group of people. We were all international students from different backgrounds, different countries, different continents. And it made a very nice, solid group of people. Was in terms of studying together, it was a wonderful time. And with those people, I'd totally do it again. I don't know, I might change the venue, but I'd definitely do it again with those people. So that was wonderful. And then ended up coming back to Angola. And that's where I met Matt and Esther back in 2013. And then I got introduced to surgery, and I definitely enjoyed surgery. So I was like, well, if you can play with the drill and fix bones, put them straight, and all those things, I'm like, I think this is for me. And so I applied to the Pan African Academy of Christian Surgeons, which is an organization that tries to train surgeons in Africa uh, to serve in Africa. And the commitment is usually about 5 years post graduation. They try to focus on missions hospitals because that's where there's a great need of surgeons. But we have graduates serving in all sorts of different hospitals throughout Africa. So currently there are PACS programs in 11 countries, and there are 14 training programs that are currently going, with a few in the pipeline in the very near future. So yeah, we moved to Gabon in 2015 or end of 2014. I spoke no French, so I had to go and learn French. I had a crash course of 6 weeks, And then I could say good morning, good afternoon, and I want bread, and that was sufficient. Moved to the hospital in Bangalo, and started with my little French, and yeah, it was a wonderful time. It's a very different setup, and I think it's very important to emphasize that um, this kind of training really prepares you for the circumstances you will encounter in most African settings, especially if you're trying to work with people that are in need, places that are very, very low resource. It was just the perfect place to be at in terms of training. So we spent 5 years there in Gabon as a family, with rotations in Kenya, and it was just, yeah, it was a very interesting way of training surgeons, but something that is actually working. So we finished 5 years there in Gabon, got back to Angola in 2020, and yeah, COVID showed up, and that was it. We stayed for 6 months, and then we had other things that happened in life, and we had to do some moving around, and moved back to Angola back in January 22, and we have been there since then. Yeah.
Wow. Um, that's an incredible training journey. I just wanted to do a bit of a follow-up question. Two
Hmm.
things. So the first is you alluded to PACS being an appropriate training program for the setting that you're practicing in now, and I think the setting that you had always envisioned you would practice in. Um, just because general surgery in many high-income countries is a bit more circumscribed. Can you just give us a sense of either like, you know, a typical week's worth of cases that you would do, or maybe a typical like, you know, couple of months during your residency, just to showcase the breadth of surgical skills that you need?
Yeah. So general surgery, basically, if you tell somebody in Africa and a lot of places in Africa that you're a surgeon, they expect you to do everything. They don't think like, oh, he's a general surgeon, should be from mouth to anus, right? Um, Not necessarily in Africa. So our days can start with, and this days actually start with pediatric cases, anything from a VP shunt for a hydrocephalus or a SOAVA procedure or something like that. You then move on to orthopedics, and then you move on to OBGYN, and then you move on to general surgery, and then you may end up doing like a dental case at the end of the day. So it really is like whatever shows up at the door, you really have to be prepared. So it keeps you on your toes, and it just but it's also, it shows that your training was good. Our training at PAX was good because we are able to feel at least somewhat comfortable. And if we're not comfortable, at least we sweat a little bit, but we actually get to the end of the case. And the patients usually live to tell the story. So um, I think, yeah, I enjoy it. It's just, I never know what the schedule will look like, and when you get there, you look at the schedule, you go like, "Hey, this is awesome, man! Like, never done this, or I've only done this once in residency, you know." And yeah, you have fun with it.
Mm-hmm. Absolutely. And we'll sort of circle back to that topic when we talk about CML, CML's future and sort of what you envision. But one other follow-up question, I just wanted to point out, because some people may have missed this like tiny little factoid, but because you had done training in Russia and then in Gabon and being Angolan, which was a former Portuguese colony. So how many languages do you speak?
Yeah, that's a consequence of like, I moved around a lot, so like, don't be. I'm not that phenomenal. I only speak 7 languages.
Oh goodness. So you're the definition of a polyglot. So English, obviously,
Portuguese, Russian, French, Spanish, Ubuntu, and Afrikaans.
That's pretty epic.
Yeah.
Okay. We can pretty much put you anywhere in the world. I guess I
Oh,
didn't speak many Cantonese when I was there, but short
yeah.
of that, you can be anywhere in the world.
Yeah, and I'm done. I'm not learning any more languages. I'm done.
I think that's fair.
Yeah.
So just back to the topic of that breadth of surgical skill then. You are, like I said, a staff surgeon now at CML alongside two other surgeons who also have a significant repertoire or portfolio of surgeries that they do on a daily or weekly basis. So as the newest member of the staff, what do you foresee in CML's future? Because I'm sure you've been doing some thinking about that. And then how can people support you in this or partner with you?
Yeah, so CML is an institution that was started back in 2006, basically in response to the surgical need in that in the area of that area of the country. One of the ideas was that eventually we would become a place where we could train people and disciple them and help them to become better and maybe put them out so that they could go and help in in not just at CML, not just the missions hospitals, but throughout the country. And in doing so, probably help change the way the healthcare system works in Angola. So, so CML right now is basically a training site for at least 7 interns. I think that's what we have. Yeah, we have 7 interns. And basically, what that does is we take people who finish medical school, and Angola does not have a proper residency program, or I shouldn't say they don't have. They do now have something that's just started, and it's run by Cubans, and so it's a little bit at its beginnings, and the curriculum is a little bit iffy. So what we try to do is basically take doctors who finish their medical school and walk through with them for 2 years, teach them the basic skills. You know, they need to learn how to do a cesarean, they need to know how to do a hernia repair, and then, you know, walk through with medical cases. Matt was there just now in December and was very helpful in helping train those guys to question things, to think about it before they do something and not just prescribe a medication because that's what they were taught. So that's one of the things that CML is doing right now. What we're trying to work towards is a surgical training site. So basically, what we want to become is a PAX training site where we'll be able to train Angolans or other Africans, hopefully maybe Mozambicans, maybe Cape Verdeans, to become surgeons and then be able to return to their communities. The exciting thing about this is that there are no such programs in Portuguese-speaking Africa. So that would be one of the first ones. And the accrediting body that for PAX is COSEXA, which is not even in Angola right now. So we would be really pioneering all those things, and working towards making surgical needs less, hopefully in the very coming future. um, but it's an exciting thing. We are looking at maybe in 2 or 3 years being able to start training 2 general surgeons, and with the goal of every year having 2 new surgeons. So if you look at it in 5 years, you start producing surgeons, and then you start putting out at least 2 new surgeons every year, and that could make a difference. If you look at our province, or the city where I live, we have 1 million people, And we have officially, we have 5 general surgeons for 1 million people. And you can imagine there aren't that many other specialties. We don't have a pediatric surgeon, for example, for the whole 1 million people. So like the general surgeons are doing the pediatric surgery. We have maybe 2 orthopedic surgeons that work out at another institution, but they very seldom have materials to do their work. So we end up at CML. We do quite a good number of orthopedic procedures. We do a lot of OB stuff. We do a lot of pediatrics. We are the center that does most of all endoscopies for the province, and not just the province, actually the southern part of the country. So if we are training people with all those skills, I think we are looking at a better future in terms of helping that region have access to surgery in a timely manner. And yeah, it's it's a big dream, and hopefully that dream is going to become reality very soon. And yeah, I'm just looking forward to it. Yeah.
Amazing. I mean, I think CML has had a very good track record of, what academic folk term service delivery, but basically just providing clinical care
Yeah.
from that part of Angola, but also people flock from all over Angola, including the capital, to be seen and taken care of at CML. So it's very exciting to hear, the plans for these next steps, right, in terms of having this ripple effect on the next generation of surgeons and even non-surgeons, other care providers, which can then go forth and train, subsequent generations. So that's super exciting to hear about those plans. And I know I previously interviewed Dr. Steve Foster, so I know that this has been a dream of his since before you and I were surgeons.
Yeah.
All right.
Yeah,
Well,
but I mean, I was just gonna add. I mean, this is a big dream, and it will require a lot of people. A lot of the times we forget that to train someone, it might take 4 or 5 different surgeons to come out and do things. I mean, I had this privilege of being in Gabon, and we had different specialists come visit for 2 months or 2 weeks, and they would take a resident, and they would just for those 2 weeks or 2 months, that resident would be their resident, and that became very important. So I mean, I know there are a lot of you guys out there who have a heart to help people in low resource situations. And this is a great opportunity. You're not just treating that patient, you're actually enabling somebody or providing the knowledge and the know-how to do things, and then that person can become independent, and you don't necessarily have to be there all the time anymore. And so, yeah, I would invite any of you who are out there who have that kind of heart, feel called, so to speak, to do such things. Angola is a beautiful country. Lubango is even better. If you ever been to Southern California, Lubango has pretty much the same kind of temperature. It does rain every day during rainy season, but other than that, it's a very beautiful place. There's a lot of things to do, and yeah, we have people who speak English who can translate for you as well, so you wouldn't be stuck without being able to communicate. So yeah.
amazing. So if anybody wants to get in touch, I mean, I'm always happy to be the middle person, but if anyone wants to get in touch with you, how would you suggest we go about that? I can link your contact info, or
Yeah, you can probably link my contact info. My email is sam.fabiano at sim.org, or you can email me at samfabio@gmail.com. And I think Esther has my WhatsApp. That's another way. WhatsApp will work anywhere because, yeah, some of the times when you're moving, don't really have access to email, but WhatsApp is always there. So, yeah.
Awesome. Awesome. Well, thank you so much for joining me again today, Dr. Sam. It was so great to hear about sort of how you've come to where you are and just your hopes and dreams and plans for the future. So I think we will end the recording there. I'm going to get my IT person to hit stop recording, and we'll see you again next time.
All right. Good being with you.
Thank you.